Hello everyone, my name is Lauren Collins and I'm a pelvic health physical therapist. I am coming today to talk about pregnancy, the wonderful miracle of life, of giving life. What I will say is that when working with a lot of patients, I have noticed the significant number of them who come without very little education about what to expect in terms of their body and kind of what's going on throughout their pregnancy. At least from their healthcare providers. So we're going to talk a little bit about that today. So first, a few of the things that you may expect when you're pregnant is one, for your ligaments and everything to kind of feel loosey-goosey, especially around your back and sacrum. Your body will emit a hormone called relaxin, which is to help the pelvis open up for birth. And so when you start to feel kind of like, I felt something just slip, that's actually a very normal feeling during pregnancy. So don't get freaked out or weirded out by it, but that's the first thing. The other thing that a lot of women experience during pregnancy is some low back pain or some pain at the front of their pelvis. It's called round ligament pain. And the round ligament pain is a part of, again, the uterus expanding and pulling on these ligaments that attach to the uterus into the pelvis that can cause some discomfort. And the low back pain can be from several things. It can be from the weight of the baby kind of pulling you forward and increasing that arch in your back. You can also have some mid-back pain with your breast growing in size because of milk coming in. And so things can get a little heavier and round your shoulders out. So you want to be careful and mindful of that as well. The other thing that women in pregnancy will experience sometimes is a little bit of urinary incontinence. And this can happen especially as the baby gets bigger and starts putting more stress and more weight on your bladder. So you may have to go to the bathroom far more frequently, and that's okay, at least during pregnancy. Pregnancy is one of those phases of life where things that wouldn't typically be normal or seem okay are more normalized. But make sure you're sitting down on the commode, emptying your bladder completely every time you go, so that you can learn how to kind of cut back on the amount of leakage that may occur from a baby jumping on your belly. So those are some things to expect during pregnancy, and there are lots of other things to expect. But check with your healthcare provider to ask about some of those as well, so that you can know, is this normal, is this not normal? But definitely some back pain may be expected. The pelvic pain may be expected. The urinary incontinence may be expected. And you can help with that too by doing Kegels. As long as your pelvic diaphragm muscles are functioning properly, and you can check with your healthcare provider on that too, it's great to do Kegels and some abdominal exercises, some bracing. But we'll talk about that again in a minute. And so those are some things to expect. Now, the other part of what people aren't told about, is how do they know if they should go to PT after having a baby? And my personal philosophy is that all women should have PT at least one visit prior to having the baby, just for educational purposes. And there's so much more to talk about, which we will get to in another video as well. But especially after pregnancy and after giving birth, vaginal or cesarean types of births, there are a lot of things to look out for. Excuse me for looking down, because I want to make sure I get all 5 of these things that I want to talk about to you in terms of 5 cues to know if you should get PT after pregnancy, and I have them written down. So excuse me while I look down for just a minute. So the first one are long deliveries. So typically women, during the active part of pushing, that period lasts typically for 30 to 60 minutes. It can be a little shorter, it can be a little longer, but what you're going to look out are for really long, the active pushing phase of labor, of delivery. If you are pushed for 2 hours or more, that's definitely a long pushing phase, and that's something or a reason why you may want to consider going to physical therapy. Another reason you may want to look into physical therapy is if you have a baby bigger than 9 pounds. Bigger babies can mean more stress on the pelvic diaphragm, so that's number 2. Number 3 is pre-existing pelvic pain or back pain, because those are things, again, once you're pregnant, we already talked about how you have this extra weight and your body's is being stressed out more because of the growing baby, and so you'll want to go for that. Another thing to look out for, as we already talked about just a minute ago, is pre-existing urinary incontinence. So some women get some leakage of urine during pregnancy because of the added weight of the baby. But if you had it before and then during pregnancy, you'll probably want to follow up with a pelvic health PT about it after to make sure that everything is okay. And the other thing, number 5, are grade 4 tears. Now, when I say a grade 4 tear, that means if you've had a vaginal delivery, and if by pushing the perineum at the perineal body has torn at the vaginal opening all the way through to the anal sphincter, then that's another reason why you'll want PT. That could have some scarring and the stitches, and so you'll definitely want to get follow up with a PT about that in terms of the healing and proper scar mobilization. So those are 5 things to really look out for in terms of wanting PT after you give birth. You may also want to consider if you had a forceps delivery. That as well can be a reason why you may want to have PT, because that can again be extra stress at the vaginal opening and on those pelvic diaphragm muscles. Now, while you're pregnant, things you want to look out for too, as we talked about with some of the issues around pregnancy, are just look out for your posture, ladies. I know everything seems like it's going all out of whack, but make sure you're just keeping your body up nice and tall, like you have a string in the top of your head. That's going to be a good way just to help kind of normalize and regulate yourself a little bit, just to kind of bring you back into, okay, where am I? I know everything's kind of all different than it used to be, but am I standing up tall? Am I holding my abdominal muscles so that they feel supported? Almost like you're trying to pull your belly button or the lower part of your belly back towards your spine to kind of keep you protected and keep those abdominal muscles protected. So those are some things to look out for. Oh, one more thing before I go that you're not often told about are diastases recti. And that is when, with pregnant women sometimes, when the tendon that connects the 2 sides of your abdominal muscles gets overstretched because of the growing baby. That is something that happens to many, many women. There is a way to correct it, and so don't freak out about that either. And there are ways to help that, especially after pregnancy and after having a baby. And that will be coming in a following video as well. So, ladies, if you're pregnant right now, congratulations. If you've already had your baby, congratulations. And ladies, keep being healthy and love your babies, and you are great and everything is okay. And so what I will also say too is I am here at Body Connect Health and Wellness. It's a new physical therapy facility that I've joined, and I love it here. So if you're looking for me, you can follow us here at Body Connect. The website is www.bodyconnecthw.com. You can also still follow me at www.vitalselfpt.com. And everyone have a wonderful and blessed day.